I'm very excited to introduce you to Dr. Gaity Ahmad, and this is Scott from Ethicon, and they'll be telling us about, electrical energy. Thank you.
So some of you may know me more than the others.
Oh, thank you for that.
Yeah, and obviously my son has refused to come in, so that's
But I love Hamza.
Yeah, and I have a neighbor here from Manchester Grammar, so I know some of you more than the others. I'm Gaity Ahmad. I'm a consultant obstetrician gynecologist, work at Penine Acute Trust in Manchester, and I'm the divisional director for Women's and Children's. My main, my special interest is laparoscopic surgery. You can. So I'm going to talk to you all about how. Thank you. How electrical energy, and sound waves, sound energy can be used in surgery, and why we don't get electrocuted when we use electric current and pass it through the patient. Right. So the two main types of energy sources that we use are electromagnetic energy and mechanical energy. And I'm not going to bore you all, and you will know much more than I do in terms of the physics of all this. But mechanical energy, so what I'm going to talk about is the sound, the ultrasonic bit. And in the electromagnetic, I'm going to talk about electrical energy, so mainly about monopolar and bipolar energy. And I will explain to you further on in the talk as to how that is used. You all know electricity. How many of you are doing physics? Loads of you. Okay, fine. So I don't need to talk about this slide. You know that for electricity we need a circuit for it to flow. It takes the path of least resistance. Those are the two things that you need to keep in mind. Okay. I'm going to skip this slide. You know what just remember that when I'm talking about using electricity, I'm talking about alternating current. That's what is used when we do surgery. Okay, so this, you'll have to play this, Chris, please. Play this. What this is going to demonstrate in front of you is, can I dim the lights a little bit? Just stop for a second. That's fine. So, what we're going to demonstrate here is that blue thing that you will see in the demonstration here is one of the equipments that we use when we perform surgery. So that is where electricity is passing. You can see the tip of that is connected to the bulb, and the bulb lights. So there's a significant amount of electric current that is being used, and it can light a bulb. But still, when that current goes through the patient's body, the patient does not get electrocuted. Right, this blue thing is the thing that we use to cut. If we want to cut anything, if we want to stop bleeding, this is what we are using. This. And this is where the electric current is passing into the patient, if the patient was instead of that bulb. So, for household appliances, you know that when we use electricity, we are using that electricity, which is electromagnetic waves, which are oscillating at a frequency or propagating at a frequency of 60 Hertz. Now, at 60 Hertz, if you touch anything, you will get electric shock. And that is because your muscles will get stimulated with that electric current. As soon as the frequency is increased to 200 kilohertz, the electromuscular stimulation ceases. Can you guess why this happens? Why does the electromuscular stimulation ceases when the frequency is so high? Have you all read muscles? About muscles? No? Okay. Could you play the animation? What actually happens is, so if you focus on the top one, that is the less than 100 hertz. So when the electromagnetic waves are propagating at a frequency of less than 100 kilohertz, you can see that neuron, there is polarization and depolarization happening. So there is enough time for the sodium-potassium channels to open, for the potassium to go outside, and for the sodium to come inside. So that is how the stimulation happens, and the muscles get stimulated. Take a seat, Lakshmi. Lakshmi is my registrar. So when the frequency is above 100,000 hertz, you can see that there is no time for the neurons to depolarize, and therefore electromuscular stimulation ceases. And as soon as electromuscular stimulation ceases, you will not get electrocuted. Does that make sense to everybody? You can ask me anything you want to ask in the middle. Don't leave it to the end, because there might be a lot of things then. And just stop and ask whatever, any time. Next. If it will go. Yeah. So the three things that I want you to remember when I'm going to later on tell you about safety of electrical current, how we can make this safer, is just remember the resistance, remember the power, and remember that the power is how we calculate voltage. Power is voltage times resistance. Now, when you look at household appliances, you will know that the voltage is constant. So we get electric current at 220 volts. Yeah, does everybody know that? Yeah. When we use electrical energy in patients, the power remains constant. We set our generators at a particular power that we want to use, but the voltage changes. Okay? And that is a very important point which you will realize as we go on further. This is how the generator looks like, which we use in patients. So as you can see, the number 25 is what the power is. So the power always remains constant. We can set it up. So if you go back, Chris, for a second. So if the power is constant and the current is constant, so the only thing that can change is the voltage. And that is where the problems arise. Because if the voltage changes, so if the voltage goes up, because we are buzzing something and keep on buzzing it, that generator will not produce any current more if we use it for a longer period of time. What happens is the voltage increases, and as the voltage increases, the current then takes the path of least resistance and travels across in other areas. And that is where you get stray current and you get injuries outside where you want it to be used. Okay. Next slide. It's working?
Yeah.
Okay, thank you. So this is what we are using at this point of time, this patient return electrode type of system. So if we don't have any generators, so when I go to the next slide, I'll show you how. So this is what our generators look like in our theaters, right? So this is where you get the power, okay? This is the lead that is attached to this equipment, which is going to be used in surgery. And this is called patient return electrode, which is applied to the patient's thigh to make the circuit complete. So in this, when we use monopolar equipment, patient forms part of the circuit. So if I go back and explain that to you. So if you look at, So if you look at this here, just assume that this is the generator, okay? So the generator will be plugged into the mains. So electric current comes from the mains into this generator at 220 volts, right? Now this voltage, and at 60 hertz frequency, this is then amplified. It travels through this path, okay? And this is the equipment that the surgeon is using. This current then travels into the patient's body. You want to apply it to wherever you want to apply it. And so that's why the tip of these equipments is really narrow, so that it's precise. So let's say you want to burn this bit area, you just attach it here. So the current flows through here, goes through here, and then to the equipment, to the organ wherever you want to cut or coagulate, and then it travels through the patient's body into this patient return electrode, and then back into the circuit. Now there are two circuits, if you see, running here. The first circuit is the main one, which goes where the electric current is flowing through this generator into the patient and whatever the surgeon wants to do, he's doing. The other one is then between this return electrode and the generator. So what the return electrode is doing is, it's trying to capture as much current as possible and then returning it back to the generator. So if this electrode is not applied properly, then the generator stops working to prevent something like this. This is like return electrode burn. You need, if I go to the next slide, I can show you how it looks. See, this is how it looks. It's broad, so that it covers a big surface area, so that the current that is collected back is spread around the thigh rather than concentrated on one bit of the body. So if you can see here, that is how it is applied. That is the correct way of application. And if you can see here, this return electrode hasn't been properly applied, and therefore what will happen here is the density of the current will increase here and the patient can get burns here. So what we have to be careful is that the patient return electrode is properly applied. It is in an area which is free of hair, free of all sorts of cream, so that it is properly gets stuck there, and make sure that once make sure that it is on a flat part of the body, so that we avoid any contact with bony surfaces or irregular body contours, because then it won't get stuck properly. So again, it's saying the same thing really, that the current is flowing from the generator. So from the mains into the generator, gets amplified from 60 Hertz to 200,000 Hertz, travels through there into the patient's body, through the return electrode into this generator. So as you can understand, the patient is forming part of the circuit. So patient is a vital part of this circuit, and that's where the problems arise. Now the way the electricity travels through the body, it will depend on the resistance. So because electricity takes the path of least resistance. So as you all are aware that in human body, what is the, no, I should ask you, what is the main sort of component of human body? Water. So what does water have inside human body? It's not, it has ions. So, and they conduct electricity. Yeah? So, what is happening here is that electric current flows, and let's say we wanted to burn this much area, we wanted to stop this bit from bleeding. Let's assume this was bleeding. So electricity is flowing here and it's producing heat, and this area is getting burned. But this will happen pretty quickly because the majority of the water will get evaporated. The proteins, the bonds, the hydrogen bonds will all get denatured, the proteins will get denatured, and this area will become more solid. As soon as it becomes more solid, the resistance will increase. And when the resistance increases, the electricity then starts traveling in directions where we don't want it to go. So, if you look at that, okay, play it. So can you see how the redness has increased? So basically the heat has spread as... Okay, thanks. So if you can see the spread of the heat, so when we started, we wanted only this area to be burnt, or coagulated, or cut. Now if we continue, using the electric current, this is where it has gone to. Yeah.
And how does this make it stop bleeding?
How does it make it stop bleeding? Because it basically denages the blood. It forms a coagulum. I will explain that in a minute. I'll show you a slide. So this is the area. Can you see how much the spread has happened? In a minute I'll tell you. So again, this is explaining to you the same thing. It depends on, if I go to the, so if you can see here, the electromagnetic waves, the frequency is high, okay? The voltage is low. Here, the voltage is high, the frequency is low. Depending on how you set your voltage, you can get the desired effect, whether you want to cut or whether you want to coagulate. I'm going to show you a clip. It doesn't have any bleeding, so if anybody doesn't want to see it, please look away. So this is no, there's no bleeding at all. There's just, it is a demonstration where they're trying to show how electricity is used to cut or to coagulate. Yeah. Liver. So you see, now the surgeon is trying to coagulate. So what he's trying to do is he's using it for longer periods of time and trying to show you that if you use it for shorter periods of time, the spread is less. The longer you use it, the spread is more. Is that clear? Yeah? So now here they're using the cut current. So high frequency, rapid spurts of electric current coming, and you can see that the tissue has literally evaporated, so you can produce a cut effect. So what you really want to do is you want to keep the voltage as low as possible so that the temperature is less, your current doesn't spread to areas where you don't want it to go. So this is another clip which is going to show you that how the current travels, and how you have to be careful when you do any surgery. So this is the uterus, this is the ovary, the white bit, yeah, and this is the fallopian tube, this finger-like projections or the fimbrial end of the tube. Now this is the scar tissue that has formed between the ovary, the white bit, and the bowel, this bit. And the surgeon, what they want to do is they want to divide this, right? They want to divide this. Now let's see what happens. So, okay. So basically, what happened was that the surgeon should have stopped as soon as this area got desiccated, became black, yeah? But they continued, and the current obviously tries to find the path of least resistance, so spread there, and you get a bowel injury. So you should have stopped here, carried on, current flows, and you get bowel injury. Yeah? Okay. So can I show them a clip then? Have we got it set up? No, I've got some. Right at the end.
This is my parents didn't call it anything. It's like this guy, like how you can recognize calling codes. Yeah. Just the guy from the side was trying to call it. No.
So this is. So
Maybe warming.
this is.
Yeah.
So I'm going to show you a clip which is going to demonstrate how monopolar electric current on a monopolar circuit where patient is a part of the circuit is used, oh, sorry, not this one, is used to take an ovarian cyst out. So this is an ovary. See, it's quite big compared to this one, which is a small little ovary. So that's normal size. It's got a cyst there. That's bowel, the white and the yellow bits. This is the uterus, and this is the fallopian tube. Okay, these are the ligaments which support the uterus. So this is one equipment that is being used as a grasper to hold the white bit. That's the ovary. The inside bit will come out, and you will see that is a cyst. And we're using monopolar electric current. That means we had the generator that I showed you, the blue color generator. That is what we were using, and so that was connected to the mains. So electric current was coming in through that generator and was being amplified, and then was connected to this equipment, which is a laparoscopic scissor. So if we go back and start. So you cut it. So you're trying to open the capsule of the ovary because you can see the cyst is here, this one. Yeah? That's the cyst. This is called a Johann, this one. And it just right there.
I can tell you you're disgusted, aren't you?
No, you're using water as hydrodissection. So this one, this thing,
I don't want to.
this has a suction irrigation attached to it. It's attached to normal saline. So you're using water. I was using water to dissect this wall so that we can take this out without rupturing it, if possible. Although it will make a lot of difference. Even if it got ruptured. Yeah.
Looks like a white green.
It's got a couple of years ago.
Don't comment shit.
Okay, so now I'm going to use this. So if you can see again, the current is being used to stop this bleeding. And now I'm going to put this in a bag. So I put the bag in through the port. The bag goes in, the cyst will go inside the bag, and then the bag will be pulled out. Any questions? Oh, those are questions. Yeah. Yeah, fine. Sorry?
Did you try out?
Yeah.
How did you record it? Was it through an endoscope?
No, you've got a stack system, right? Because this is all laparoscopic, so you can't see what you're doing. There's a camera attached on the top of the. We don't have any, like a telescope sort of thing. You put it through the umbilical port. Have you got anything? Okay, so he's going to show you first. Okay.
Like everyone's totally left when it gets out of you.
I don't know what it's talking about.
Well, on the right side, at least I haven't not turned the camera yet. Yeah.
So this is a port that is used in laparoscopic surgery. So what you do is you make a small incision in the belly button and put this into the abdomen. So then it becomes, and then remove the top bit. So it's like a hollow sleeve. And then you can attach your telescope here and with the camera. So this is in the center like that. And then you've got two little ones on either side where you put all these other instruments in. Sorry?
Does it work like total and total refraction?
I'm sorry, I couldn't.
Does it work like total and total refraction?
I'm not
Yes.
sure. You would know that more than I do.
It does.
Yeah.
So that particular cyst, is that like how big is that in comparison to the
Well,
average
like
size
6,
cyst?
7 centimeters.
Is that like an average cyst size or is it
Yeah.
larger? 7
Anything
centimeters.
less than 5 centimeter you don't remove
Right.
because they dissolve they just disappear on their own. Ovary normally is 3 centimeter in size, so you could see the size of the cyst, nearly double the size of the ovary. It's around 6.
Is that 7 centimeters in diameter?
Diameter.
Yeah, it's quite big.
Anybody else was on? Somebody else? Yeah. Yeah, well, there is a lot of, the smoke, we all have smoke extractors, so that is connected to the patient's one of the ports, and the smoke is extracted out. Because the main thing, it doesn't harm the patient, but what it does is that it makes the field very muzzy, so you can't really see very well. And also there are long-term studies saying that, they shouldn't, should be taken out properly. So, okay, so now the risks of using electric current. Can you all tell me what the risks of using electric current are? I'm going to sit down now. One by one. Okay, come on, you know what the risks are. Yeah, come on. How many of you are going to do medicine?
Cardiovascular arrest.
What else? Suppose you are not operating and the patient doesn't have a cardiovascular arrest. So, what else? Yeah.
There's something wrong with the computer controlling it. The patient might get killed.
What you're trying to say in principle is the fact that if there's anything wrong with the generator, and either the electric current what can happen? So if it stops working, then you can't do the surgery. I suppose that is one of the things that can happen. But usually these generators are really good. If they stop working, then they don't cause harm to the patient. If there's anything wrong with the circuit, they will automatically, as a safety, switch off. You will not be able to run them. Suppose if the patient return electrode is not applied properly, they will not run. You will not be able to use it. What else can go wrong?
So go on.
Spray damage as well.
Yeah, that's it. Spray damage. What you mentioned. Okay, yeah, that's the most basic. Yeah.
What I was about to say was, what if it's like in a critical moment, so you have to cut that tissue at that moment, and then the system broke down because it's like.
So yeah, no, that can happen. And if something like that happened, that you were about to cut, and then the diathermy machine stops working, then that's fine. Either you use an alternative energy device, which I'm going to explain to you the harmonic and other things that we have, or we just don't use any of these devices. We just open the patient up and stitch it. Because you will always have sutures in later, so at least you can spray.
So what are the actual benefits of using electrosote in terms of scalpel during fucking incision?
Because if you're using a scalpel, so what you're doing is you're cutting it, right? So then you will have to then suture it separately. But with this, what you're doing is you're coagulating and cutting at the same time. So you then it is quick.
Another thing could be atrial fibrillation, which could lead to arrhythmias and heart palpitations. Is that another risk?
Because of the electric current stream.
Yes.
But I think you missed that bit where I talked about the amplification. It is actually the electric current that we use is the frequency in normal household appliances 60 hertz. What we are using is 200,000 hertz, so it gets amplified so much that the electromuscular stimulation ceases, so atrial fibrillation therefore will not happen. Okay. So, right, so the risks. So you can have all these things, I'm going to talk about them. So what can happen is, you're about to sort of use something, let's say you've got you had one bit of it, and you were going to coagulate this finger, and accidentally what you did was there was a loop of bowel here very close by, and you touched it when the metal was really hot. So you can cause injury by direct touching, touching other organs in the body where you weren't intending to touch them, so they can get burned. So that's one bit. The other bit is that if there is another conductive instrument or equipment close by, that can get hot, and electric current can flow through that. So for example, if you have two instruments inside the patient's abdomen, so you've got this one and this one, and you're passing current through this one, and the intention is to actually just use this one, and if this bit touches the metal bit of this bit, then current can go through this one as well, and therefore you can cause accidental damage there. So I'm going to show you here a clip, not for the faint-hearted. This is just animation, so you'll be fine. Just see. So if you see this bit, this is the equipment, and this is accidental burn, and you see how the current is flowing from this one to this one, although this one doesn't have any electricity attached to it. Electricity only attached to this. Now, if you see into the patient's clip, so see this one. So the intention was to burn only the top bit, but you see how, because there are clips there as well, the whole thing is getting burned. Now, as you can see in all the equipments that we use, they have an insulation sheet here. So the current is flowing inside, but the black bit is insulated, right? So if anything, if this insulation bit breaks because of repeated use or whatever, falls or we just breaks for whatever reason, the current will obviously come out of wherever the insulation has broken. So that is something that needs to be kept in mind. So wherever the insulation is broken, and if another organ gets it, oh sorry. So here, this is what we are using. This is where the insulation has broken, and the damage, then what happens is it damages the bowel. This is bowel. So whichever organ will come in contact to the area where insulation is broken, it will damage that. So we need to keep that in mind. Always check the equipment before we use any. Okay. What is a capacitor?
Something that can hold charge.
That's all. You just read it from there. Basically, what they're trying to say here is that if you have electric current passing through two different instruments, or of different, what should I say, conduction is different. They have different properties in terms of their conduction. One is a good conductor of electricity, another one is a poor conductor of electricity. Then you can run into problems. So if you look at this one, so this is an equipment that's used for surgery. You've got electric current coming from here. It travels there. This bit, the grey and the blue bit is this. Okay. So what they're saying is that the blue bit is made up of plastic. The grey bit is made up of metal. So what happens is the current travels here, goes in. This is the insulated bit. There is another metal here. Yeah, if you look at equipment. So there's another metal here, and this is the black bit, this is the insulation bit. In the picture, this appears as light grey. So this is the insulation bit, this is the metal that will be used. This is the trocar, we call this trocars. So when the electric current goes in through here, goes in through, and then it's going back. Then it goes back. This part is made up of, this is all insulated, so this is fine. This bit is made up of metal, and this bit is made up of plastic. So So this gets heated really fast, good conductor of heat and electricity. And this bit obviously is a bad conductor of heat and electricity, so therefore current cannot travel out and back into the patient's abdomen, but actually gets concentrated in this metal bit, and the metal bit gets really hot, and anything that comes in contact with the metal bit will get burnt. Does that make sense? Okay, so I was talking to you about, the bit that I've spoken to you about is monopolar current, where patient forms part of the circuit. Should we show them the slide at the end, the ectopic one? The last one. So this is another clip where I'm using monopolar current, where the patient came with a lot of bleeding, pain. She's got an ectopic pregnancy. Okay, so this is patient, just stop it. So if you just look at it, this is the uterus. Okay, this all bit is blood. Okay, and this is the fallopian tube. Normally the fallopian tube is very thin. It is this bit is the normal diameter of the fallopian tube, and you can see this swollen bit is ectopic pregnancy. You all understand what ectopic pregnancy is? Where pregnancy is outside the uterus. So it's here in the tube, and this woman came in with a lot of pain and had missed her period, wasn't feeling particularly well. We took her to theatre, and here we go. So we found that this was an ectopic. So I'll keep saying. So this is, can you see how swollen this is? That's ectopic pregnancy here. This is all blood, and obviously you all know how it's all blood. Okay. This rounded thing is bowel. So now what we need to do is we need to remove this. So I'm using electric current here. See, so I'm coagulating and cutting at the same time. So first I'll coagulate. Once I've coagulated it, all the proteins become denatured. The blood clots. You can ask me any questions.
Will this lady after you perform this operation still be able to have eggs go down this fallopian tube?
No, there won't be any fallopian tube. I'll remove it right till then, because if you leave any bit in, then she's 20% more likely to get pregnant. The normal incidence of ectopic pregnancy is 1%. Okay? If they have had one ectopic pregnancy, this increases to 10%. Right? So basically you want to remove the whole of, can you see the whole of the tube needs to be removed. So even the bit which is normally removed, so that there is no chance of egg coming in there. But the ovary will function normally, and the eggs can travel from here to the other side. You see, this is the normal tube. And again the same bag and egg Yeah? Ectopic pregnancy is where, normally the pregnancy should be in the uterus. Yeah? When the pregnancy is not in the uterus, it's anywhere outside the uterus, that's called ectopic pregnancy.
The baby's in the fallopian tube.
Yeah, baby's in the fallopian tube.
And it might grow.
It might grow, yeah, it can grow up to 12 weeks, and then it ruptures, because you see the muscle in the fallopian tube is weak. It hasn't got the strength to be able to stretch that much as the uterine muscle. From the blood? No, but no. The first 12 weeks of the pregnancy, there is no placenta. Even when the baby is in the uterus, there is no placenta. It's just from the blood supply from the mom. Sorry? Oh, you can die. It's a medical emergency. You need to take the woman to theatre and take that to the family.
I realize it just killed any chance of me becoming a surgeon. Yeah.
Baby's gone. Baby's not from your baby. It's like being pregnant. Yeah.
I was just wondering, like, what the benefit of using the bag was rather than just kind of take, like,
It won't come out. It's big, you see, so you have to put it in the back so you can, and you don't want to spill any contents in the abdomen because it's got pregnancy inside. I mean, that's what you suspect it is, but you have to confirm that. You have to send that to the lab for them to look at it and confirm that definitely this was the right thing to do. So that's why you have to put it in back. You don't want anything to spill, and it's not going to come out through the pores. They're really small. This bit's quite big.
You know when you burn the tissue? Does it smell?
Yes. Like what do you mean by No, because majority of it will go out. Body will not store it. See? Yeah, it's grounded because you're on the table and the table is grounded. So majority of the patient is part of the circuit, but when the current comes out of the patient's body, it's all grounded and returned to the generator. Yeah.
What happens if you burn unintended areas? Like, what do you do with it?
So it depends on which area you've burned. So if you've burned areas which are, let's say, what should I say? Suppose you burn bowel. So what does bowel carry? Bowel carry contents in terms of it carries acid, it carries food contents or fecal matter. All that thing will come inside the abdomen, and the patient will get peritonitis and can die. That is quite serious. If you burn the bladder, you will make a hole in the bladder. Yeah. So then you'll have to do a stitch diet. You can. It depends on what you burn, and the damage depends on that. Yeah.
So, after you burn a fallopian tube, so does that woman only have one fallopian tube?
Yeah, she's got one fallopian
Does
tube.
that decrease the chance of her becoming pregnant?
Well, slightly less, but not necessarily. She still has a 70%, 80% chance of getting pregnant
Why? I mean, if
by the other tube.
So, okay, so it's not like it's 50. No, I don't know.
Sorry?
I don't know how it works. Like,
No, it's not like that. It doesn't work like that. You see, it's not like a body is not like a robot that 1 month the ovulation will happen from this ovary and the next month it has to happen from this ovary. It doesn't work like that. So it doesn't. So even if there's one tube has gone and only the other tube is left, still you have a 70% chance of having a normal intrauterine pregnancy.
but what is that chance if you have both fallopian tubes?
If you don't have a fallopian tube, you can't get pregnant.
If you have both your fallopian tubes working, then what's the chance that you get pregnant?
The infant normally.
If both of your fallopian tubes are working fine,
If everything is working fine,
yeah.
then 95% of people can get pregnant within a year.
95. Okay.
Okay.
That would be like the first one.
Yeah. Can I move on? Yeah. So the other one, one was the monopolar that I've spoken to you about, where patient is the part of the circuit. The other bit is bipolar, where the next slide. Where patient is not the part of the circuit. So what happens here is that the same thing again, you have a generator and you have current flowing through the generator into the circuit, into the patient's body, but in the bipolar circuit, the current flows through one end, goes through one tip of the equipment, through the part, whatever you've got between the two ends of the grasper, and then back through here. So the whole patient does not form part of the circuit, and that is considered to be safer. Yeah. So in the previous one, once the current entered the patient's body formed the part of the circuit, and then it went through the whole patient's body. But in the bipolar one, it does not. So can we show them the clip, please? The last. It's that one. Yeah. So you can see this one. I'm going to show you. This is the fallopian tube, the ovary. I'm going to do a hysterectomy in this patient. So this is a bipolar equipment. So the current is coming in through one end, going through the other back. Patient is not forming part of the circuit. So we're going to ovulate that first, and then, so she's having her ovaries removed and the uterus removed. This is a scissor. So you're going to cut it. And you can see it's not bleeding. Somebody was asking me why knife is not used, and that's the only reason. Because if you use knife, it starts bleeding, then you have to stitch it, and that takes forever. These are all supports of the uterus, so all of them have to be first coagulated and then divided.
Wait for surgery.
For heavy menstrual periods. Yeah, but you see, the thing here is that it's all about quality of life. You see, and that is something that only the patient can decide. Oh yes, you know, we can give them a choice, but then it's a Sarah, you can't ask me.
Someone keeps asking what LEDH stands for.
Okay, so I'm not going to show you the whole. Really? Take an hour. So this is where separating the bladder. The top bit here is the bladder. This is where the arteries will come. Separating the bladder here.
Anyone getting the royal coffee? That clock is slow. It's 5 past now.
Are you? What time is it supposed to finish? What time is it? So we don't have much time. So I'll just quickly run. Okay, we'll stop then. Just stop. Okay, next. Ultrasound. So I'm going to briefly talk about the sound. Did you want to ask?
When is it that you use monofilament?
Well, the idea is that you should use bipolar. You should use bipolar. But sometimes equipments don't work. All sorts of things happen in the hospital, so you just end up using whatever is available. Yeah.
What does LADH stand for?
Laparoscopic assisted vaginal hysterectomy. Okay, so I'm going to talk about how sound energy is used in surgery. So we've got harmonic, scalpel. It's here. Do you want to show them, Chris, and then they can understand it better? Yeah? Yeah. So Chris is going to show you how the sound energy is used in surgery. He has got some, basically what happens is, I'm just going to briefly tell you. So, you know what the audible range is of the sound, so we are using it at more than 20,000 hertz. Okay, so this is what I'm going to show you here, the harmonic scalpel. This is what I'm using most of the time, because so that there's no electric current, there's no electricity flowing in and out of the patient, and equipment's working and not working. So this sound energy is what we're using at this point of time. So if we move on, so we've got a handpiece. Okay. Hello, you were asking about coagulation, and so basically it's all about proteins being denatured. That's what it's all about. Hydrogen bonds breaking and then forming a sticky coagulum which stops the sort of bleeding, blocks the vessels. That's how it really happens. It's because of the heat. It's all because of the heat. But there's less heat produced in this compared to electricity. Yeah, so that's why it's supposed to be safer. So basically what happens, and we got a nice little clip where we can show them. Okay. The harmonic.
There's one on the other laptop.
Do you want to plug it in? So we can just show them how it works.
That's the Android.
Yeah. Okay, fine. So this is what we use for sound. So basically, sound energy. This is the generator. It's plugged to the mains. Electricity is coming in. There's a piezoelectric. This is like a crystal inside the handpiece. This electricity makes the crystal vibrate, and this vibration is then transferred here. So this vibration then travels through the shaft, through the two ends of the harmonic scalpel, and they vibrate. They are vibrating at 55,000 times per second, and that's why they are producing heat, because of the mechanical vibration. So Chris is going to show you a little procedure. I'm not doing this.
Are you doing the other ones?
I was doing the other ones, yeah. This is just scar tissue. This is the consultant who's doing it.
You're that guy.
He's going to do it.
What am I doing here?
So you see, this is the harmonic scalpel. So basically, mechanical wave transmitting heat energy and helping to coagulate and divide the vessels. Right? So you can see here. Basically, this blade, the white blade is the passive blade. If you can see, it has got two ends. And this dark one, the black one, is the active blade. The active blade is vibrating at 55,000 times per second. And that's why it's producing heat. And that heat is being used to coagulate and cut. Okay?
So, guys, you see the way we're all stood around the patient there as well? So we're just watching a television screen as you are now.
Yeah.
So for instance, when Dr. Ahmad is actually operating, she'll be using her devices through the trocars. So if the patient's on the table, she will literally, in a triangular motion, be inserting the devices into the patient. But the difference is, if we were to perform surgery on a patient, we have our own 3D vision, so you know when to stop. But because you're watching it on a television, they don't actually know kind of how far to stop. It comes with a lot of experience, doesn't it? So what you're actually seeing here is extremely fluid, and the video shown before, in that it's hard, all jokes aside, not to poke the patient and kind of go too far with it. So it's very skilled to actually be able to perform laparoscopic surgery in the first place. So the reason that we do make our devices, we have to try and make the devices as easy to use as we can. So for instance, you saw some of like the bipolar devices before, and they literally have one function, so either to cut or coagulate, and that's either when you grasp it in the tissue. But like Dr. Ahmad said,
yes,
with this we can use different things, so you can like back score.
You can ask Chris.
Go on.
When you train, you use like.
No, when we're training, we have a lab sim. We don't train on the patients.
Oh,
You have to. Sorry, I can't hear you.
Do you take organs? Do you do like organs that take that body?
No. We don't do on dead bodies, but we have computerized programs, and the training is on simulators, and you have to do that much on simulator, and then you do on patients. That's how it works.
So how many years do you have to have been training for to be able to do it?
How many years? What did you say?
You have to do training.
You have to train. The program is for 2 years, but actually that is the advanced training module. Otherwise, you have to train for 7 years. Yes,
What's actually going on at this?
hysterectomy.
It's
Hysterectomy.
Thank you.
Yes.
In which cases would the ultrasound be used over the?
Ultrasound is the way to go. It is really good if anything where you can use it anywhere in any surgery, and it's actually considered to be safer than using electrical energy because the heat spread is more in electrical energy, and this device is obviously the thermal spread is only 2 millimeter, so it's really safe. You can use it on top of the ureter bowels and things like that. So I use it for nearly everything I do.
So to be fair, we have brought devices in, and obviously because we haven't got human tissue or anything like that, we have just got oranges that you can use it on.
Do you want to have a go at it?
Yeah. So I will say just before we pile it in, although it's mechanical energy and it's not electricity that's going to go through to the patient, the jaws of the device will get extremely hot. So it'll be about 100 degrees, I think it is, so don't touch the end of the device. There's 2 different settings, so if you press the maximum button, that will cut it, and you'll hear the loud tone. If you press the minimum button, that will coagulate. So when you're cutting, it will cut through quickly, but it will still kind of stop the bleeding. But if it was like a vital vessel that you needed to seal, you would coagulate it more. So what you can do is on the likes of the orange, if you hold it, you can see that it will cut through, and you can actually back score all the way down. But then what you can do is, if you insert it, if you grasp it through, you'll see it will cut through as well. So once you've kind of cut through the tissue and you feel the jaws are together, just try not to keep cutting because it will break the device because it'll just keep rubbing against the top half.
How deep do you think?
How deep is it go?
Like when you.
Well, it will only go. It will only go if you were kind of so you could go inwards like that.
Everything will go.
But you wouldn't want to
But
do that.
obviously you don't want to.
So for instance, if there is like a little bit of a bleed on the tissue, the surgeon can just simply use the back of the device, or they could actually grasp it between the jaws and then close it that way. So you are more than free to have a go, but please just be careful with what you're doing.
Alright.
You guys want to go?